I'm Charles Martin. I'm Chief Technology Officer at Carebook. So I oversee all software engineering activities, product development processes, software development processes, and some operations. The company Carebook, we're a team of about 75 people. We build a digital health platform for pharmacy, employers, and digital health providers. Developing a medical device is a highly regulated process, and making sure that we can align these processes or integrate these processes, our development processes that want to be iterative, engaging with the customer with this highly regulated space was clearly a big challenge for us. I think BML was quite successful in describing what it meant to be a medical device and advise the management team and all the stakeholders involved in that project what it meant and what it meant to become a medical device, both in terms of impact on our processes, but also impact on the way we communicate with our customers and the way we market our device. So that's one part. So building awareness was clearly something that BML has been really successful to do. On my part, my involvement was more, as I said, in modifying our development processes. So advising us on how we would integrate the ISO 13485 standard in our processes was clearly where I spent most time with the BML team. The fact that BML was knowledgeable both in software development processes and in medical device accreditation was a big asset, at least for me. They understood what iterative software development meant, and they were really careful in adapting our processes to support the standard and not completely forcing a complete change in the way we work. And having that dialogue back and forth in terms of here's how we work, here's how we need to be able to iterate, here's the regulation, and how can we best adapt the regulation to fit into our processes was probably what the one single thing I appreciated most about working with BML. What I appreciate with them is the fact they were always using as a starting point the way we're currently working, and not necessarily as a starting point the way the standard was prescribing things to be done. The fact also that they introduced you to a number of experts whenever needed, for me specifically, was when we had to integrate the QMS, the quality management system, into our ways of working. We were introduced with a set of experts on their side and we worked with them to really refine how that would actually be done. If we had a project of a similar scope and in the similar field, for sure, this is something I would consider greatly. I would definitely recommend BML technology for any company looking for medical accreditation on a software device.